I struggled with horrible back pain for more than 10 years, and during that time, I talked to more than a dozen doctors. 99% of what they recommended was useless at best. In many cases, it actually did more harm than good. Yeah, I know. Some of you may be thinking this is insane. Others, you're probably thinking right now, like, yeah, that's what happens. That's what happened to me as well. How did we get here? Doctors are supposed to be some of the most competent, most useful people on the planet. And yeah, look, I get it. Like, there are good doctors. Maybe I've just been unlucky. And maybe, as the saying goes, if everyone around you and everyone you meet is stupid or incompetent, maybe you're the one who's stupid and incompetent. And I am open to that idea. Maybe I am somehow in the wrong here. I mean, my back hurts. I go to the doctor. I expect to get some help and I don't get help. But maybe I'm somehow in the wrong as well. No, I really mean this. Like, maybe I'm the common denominator here. Maybe it's something about me. But the reality is, I'm far from the only person to whom this has happened. Just go ahead and do 30 seconds of research on back pain, and you will quickly find out that this is almost like the default. A lot of people go through this problem. This is alarmingly common. So, what's going on here? Why aren't doctors better at helping people with chronic back pain? I actually thought about this a lot, especially during the first few years after my injury, while I was still hoping that doctors may be of some use to me and may help me. So far, I've identified 5 possible reasons why doctors are useless for chronic back pain. Would you like to hear them? Yes? Awesome. Let's do it. Just keep in mind that the last reason is a little bit weird. A lot of you will probably disagree with me, but some of you may say, like, okay, yeah, that's actually a good point. So, reason number 1 why doctors are useless for chronic back pain is they're operating purely based on theory, and very often they don't have any personal experience at all. I'm not in favor of being a special little victim, but when it comes to chronic back pain, a lot of you may know this isn't your typical illness or disease. This is not some common disease that you treat or solve with a pill and it's gone after that. This is something that can haunt you for days, months, even years. In my case, it was an entire decade. And a lot of people have very tough time understanding what you're going through. I know this happened to the people around me. They tried to support me, but ultimately they couldn't understand, like, how can you be in so much pain for so long? And how can nothing work? Like, anything that anyone recommends doesn't even come close to working. People find this confusing, and understandably so. It's really weird. It's a complex issue. It's not a simple mechanical injury. And that's a really good reason why doctors are not exactly useful in addressing this problem. They just don't know what it's like. They have the theory, they have some theoretical framework or knowledge, but when that fails to address the problem, they're like, what am I supposed to do with you now? Like, you don't fit into the box of what's supposed to help you. On the other hand, and this is something I noticed while researching, if you just go through the experience of someone who's been through this, who knows what it's like to face this issue, you may actually, weirdly enough, receive more benefit just from knowing that someone understands what you're going through. And of course, their advice is gonna be much more useful. This is one of those areas where experience is crucial, it's paramount. It beats theory any day of the week. A lot of what I discovered to be useful and helpful for my back pain came from people, usually on the internet, who knew what it's like, who had experience, who had noticed some improvements by applying some techniques, but all of that came from their own experience. And reason number 2, and this is related to the previous reason, is that the diagnosis is actually not the root cause. So typically what happens to most of us is we go to the doctor, we tell them our back hurts, they try to diagnose us, maybe they do an MRI scan, and often what ends up happening is a diagnosis like maybe a degenerative disc disease, sciatica, herniated disc, bulging disc, something along those lines. And then what happens next is you get recommended solutions for that diagnosis. And that doesn't work, so you get recommended another solution for that exact diagnosis, and another one, and another one. And before you know it, you've spent 10 years in back pain, which is what happened to me. And look, for a lot of people, they actually may see value in treating the official diagnosis. This can happen. But for a lot of us, and I suspect this is the majority of people who struggle with back pain, the diagnosis has absolutely nothing to do with the root cause of the pain. I talk a lot about this in my other content on this channel. And by the way, I also have a free book that you should probably read. I go about this in a lot of depth in there. Basically, what's the root cause is typically some sort of a emotional or psychological issue that's really torturing you since you're a child, basically. I know it sounds quite unbelievable, but trust me, if you address this in the proper way, you will notice great improvements in your back pain. Go check out the book. It's completely free. I wrote it just so that people can heal. The link to it should be in the pinned comment or description. I think you're going to find a lot of value there. So if you try to solve the initial diagnosis that doctors give you, you may be stuck in a loop that's going on for a while. That's probably a good sign that you should explore these other possibilities and look for solutions to a different root cause. Which leads us to point number 3. This is connected to the previous one and the previous one. I guess it's all connected. Doctors tend to usually miss the forest for the trees. Once they have their neat little diagnosis, they're trying to solve the vertebrae issue, the degenerative disc disease. And in fact, they don't even try to solve it because there's no cure for this. This is like a permanent situation that you have to deal with for the rest of your life. You can only treat it, you can only manage it, but you're supposed to struggle with pain for the rest of your life. But anyway, they're gonna try to laser focus on this one little issue, and they're gonna ignore the rest of your body, the rest of your life, the rest of your situation, which is not the way to go, it turns out. I used to think a lot like that as well, just zone in on one specific detail and try to solve it, but it turns out there's a lot more value at looking at the entire system. Again, this is related to the previous point. You want to look at the big picture. You don't want to look at just the diagnosis and try to see if there's a solution there. Reason number 4 is I believe doctors are actually operating on an outdated knowledge and playbook when it comes to chronic back pain and chronic issues in general. And we can even take a more sinister, cynical look at this and say they're not even operating on an outdated playbook. They're just a shill for big pharma. But I don't want to go there. I believe that even though a lot of doctors may be a little useless and possibly overrated in a lot of cases, I think that the majority of them are still moral, good people, so they don't just shill drugs that get people into horrible addictions. In any case, the blueprint for treating chronic back pain is usually painkillers, some sort of therapy, maybe injections, maybe even surgery as sort of like a last-ditch effort, and that rarely solves the issue. In fact, according to the official, let's say, Western medicine blueprint for back pain, there's no cure for this. There's not a lot you can do. You have to kind of live with this permanent injury, which is false. I know this because I sort of kind of healed, if I'm being honest. I went from terrible, horrible, constant pain to now being I'm almost never ever in pain. And keep in mind, this is supposed to get worse as you age, when I'm feeling better than ever in my body right now, better than when I first injured my back, which was 12 years ago. The typical solutions, painkillers, drugs, physiotherapy, injections, they can be useful to an extent, but they will not address the root issue, the real cause, which will typically be addressed, as I mentioned, with resolving important issues in your life, as well as a strong emphasis on exercise and nutrition. This is key. This is really important. I talk a lot about this in my book. Once again, it's free. There's no reason for you not to check it out. Number 5 reason is a lot of doctors are not actually healers. What do I mean by this? I have this sort of a personal distinction that I make between a person who has all the credentials and the diplomas and the certificates and another person who's actually good at healing people. Obviously, they can overlap, and they do in a lot of cases, but oftentimes they don't. You see, a doctor is a person who studies a lot, they work hard. A lot of times there are good people, they genuinely wish to help, but they're busy, they're overwhelmed. Oftentimes they're not even like compensated properly, in my opinion. And on top of that, there's jerk like some people who even talk smack about them all the time. But we also know that the stereotype of the smug doctor is there for a reason. We've probably all seen at least one doctor who, you go to their office, they don't really pay a lot of attention to you. They kind of look like they're annoyed, they want to get rid of you quickly. Maybe they scribble down something that they believe it can help you, and you're out of their office in like a few minutes wondering like, did this just really happen? Like, a few minutes, maybe one or two quick rapid fire questions that I didn't even get to answer properly, and they know the answer like magically without even like thinking about it too much. It's easy to get a sense that you're in a cold environment that doesn't really care about you. They, even though they do their job, they're not really there with you, they're not there for you. On the other hand, let's take someone like, let's say, a caring grandma or your caring mom or someone like that. A lot of us can remember, like, as a kid you get sick and your mom is kind of like, her presence is healing in a way. Or even like, I like to use grandmas because it's kind of more cute, but it's actually also very effective. Like, grandmas are really good at this. They're like, oh, you poor thing, like, let me get you some soup, let me like tuck you in, give you like all the fruits and vegetables. I know this is not exactly scientific, but nobody can convince me that this doesn't have an effect. In fact, I'm now at a point where I believe this is even maybe more important. And keep in mind, I'm not exactly like one of these magical voodoo hippie kumbaya people that only believes in like, mind over matter any day of the week. And like, not at all. I'm a programmer. I'm like a really rational, logical person. I'm very skeptical of a lot of things. This is just something that I noticed. Like, some people with their, well, vibe is actually the best way to say this, with their mere presence, they have like such calming, such healing properties that you just start feeling better with them. And I'm not even like some super religious guy or anything, but I'm sure that if you ask people who met like maybe Jesus or Gandhi or people like this, or some of like the saints from history and everything like that, I'm sure they would describe like, yeah, they're just so, their presence is so calming, so like beautiful, that your body starts kind of healing on its own. I know this is a little bit out there. Feel free to disagree with me on this. This is just something that I've noticed myself. Like, the doctors, you go in their office, they're kind of cynical, they're in a rush. Maybe they mean well, but they don't exactly always show it. They scribble something, they give you the prescription, and you're like out of there, even thinking like, does this person even like look at me as a human being who's suffering, or I'm just like the next number on their like file system. And on the other hand, I just sometimes go and visit my grandma once in a while, and I feel amazing when I leave there. She just gives me such great like energy, and she has like an aura of care and empathy. And I think that's really powerful and useful, even for chronic back pain, especially for chronic back pain. My name is Mate from Real Deal Heal. Thanks for watching. Like and subscribe if you have chronic back pain. Share this video with someone who you believe might benefit from it. Ask any questions in the comments. Let me know if you think I'm full of it, with like especially the last point. I kind of enjoy debating these topics. Hey, respect your doctors. Don't disobey them. Give them a proper shot. A lot of them mean well. Maybe I just didn't run into a lot of great doctors, let's just say, but I'm sure there's plenty of them out there. Give them a fair shot, but also don't be too surprised if they recommend things that don't end up helping you a lot. And when that probably inevitably happens, go check out the free book, completely free. I Want You to Heal. I want you to use it for healing your back. Subscribe to this channel. I want to provide you with a lot of free value on healing your back. I know how much this hurts. I've been through it all. I have the scars to prove this, and know I can help you at least feel a little bit better. Subscribe, like this video, and until next time, be brave.